Do you know what fibromyalgia is? It's a disorder that's often misunderstood, yet it affects millions worldwide. Imagine feeling widespread pain throughout your body, battling constant fatigue that seems to have no end, and dealing with tender points that ache at the slightest pressure. That's the daily reality of living with fibromyalgia, a complex condition that primarily affects the musculoskeletal system. Now that we understand what fibromyalgia is, let's delve deeper into its symptoms, particularly in women. Fibromyalgia symptoms can vary greatly from person to person, but women often experience a certain set of symptoms. Among the most common is widespread pain. This isn't just a generalized ache. It's a persistent pain that can be felt throughout the body, often described as a deep throbbing or a sharp, stabbing discomfort. Another symptom is fatigue. This isn't just feeling a little tired after a long day. It's a pervasive exhaustion, a kind of weariness that sleep doesn't seem to alleviate. It's waking up feeling as though you've run a marathon in your sleep even though you've been resting. Cognitive difficulties, often referred to as fibro fog, are also common. This can mean struggling to focus, to remember things, or to perform mental tasks that were once easy. It's like trying to think through a thick fog that just won't lift. Frequent headaches can be another distressing symptom, sometimes accompanied by sensitivity to light or sound. Morning stiffness, too, is a common occurrence, making it difficult to get out of bed and start the day. And let's not forget irritable bowel syndrome, a condition that often coexists with fibromyalgia. This can mean abdominal pain, bloating, and either diarrhea or constipation, sometimes alternating between the two. These symptoms can greatly affect a woman's daily life, but there's more to it. Continuing our discussion on fibromyalgia symptoms in women, let's explore some more signs of this condition. Sleep disorders are a common symptom, and they can manifest in several ways. Some women may experience insomnia, finding it difficult to fall asleep or stay asleep. Others may suffer from restless leg syndrome, a condition that causes an irresistible urge to move the legs, often accompanied by uncomfortable sensations. Sleep apnea, a disorder where breathing repeatedly stops and starts during sleep, is also associated with fibromyalgia. Painful menstrual periods are another telltale sign. Women with fibromyalgia often report periods that are more painful than usual, which can disrupt their daily life. Numbness or tingling in the hands and feet, also known as peripheral neuropathy, can feel like a pins and needles sensation, or a burning or freezing pain. It's not uncommon for these sensations to come and go, and they can be quite disconcerting. Lastly, women with fibromyalgia may develop heightened sensitivity to external stimuli, such as temperature, light, and sound. This means they could feel cold when others are comfortable, or find normal light levels too bright. Even everyday sounds like a phone ringing or a car honking might seem excessively loud. These symptoms can be overwhelming and difficult to manage, but knowing what to look for can be a first step towards getting help. We've covered quite a lot about fibromyalgia symptoms in women. From chronic pain, fatigue, sleep disturbances, to cognitive difficulties, these symptoms can significantly affect one's daily life. It's important to recognize them, not for self-diagnosis, but to seek professional medical advice. This condition, though complex, can be managed with proper care and treatment. Remember, awareness is the first step towards understanding and managing fibromyalgia. Don't hesitate to seek help if you or someone you know is experiencing these symptoms.